Good morning, ladies and gentlemen. We're about ready to start here. Thank you all for being so patient and giving the rest of our guests a few more minutes to get in. My name is Michelle DeVito, and I'm the Family Services Program Manager with MWR. And the seminar that you're attending is part of the MWR seminar series. We've been very lucky to have a lot of great resources available to us. So this summer has been our retirement summer. We're going to have 3 of them. This is the second of our series, and it's going to be with Social Security. So a couple of things before we get started. Please mute your phones. If you need to take a call, please step out, just so that we can just continue to go on. We'll catch you up and answer any questions when you come back in. I will let you know that this is being recorded, so it'll be available probably in about a week. It'll be available to view, and I'll send out the webpage link for those of you that have been to the MWR webpage. It'll be on the MWR webpage under family programs, seminars, and then archives. Our guests have also been very gracious and said we can use their slides, so I'll also be posting their slides, PDFs of their slides, so that you can look at those as well. Because I don't know about you, but sometimes I need to review things. It doesn't always stick the first time when it's complicated. So a couple of other announcements for you. A reference MWR, we have some great activities that are going to be coming up this week. We've got the Powder Blast on Thursday. Over at the Fitness Center, we're going to have a dive-in movie on Friday. Come watch a spooky movie with us in the pool area. Kings Island DSCC Family Day tickets, for those of you that don't know about that, those are available at ITR. Please check that out. And just a plug for the next of the seminar series. In August, we'll be having retirement planning 2 years out. And I talked to the speaker on that, and his comment was, it is good information no matter how far out you are or how close you are. So if you want to mark that on your calendar for the 7th of August, again, we'll be here in this location. So without further ado, because I know the reason you really came here is reference Social Security, not everything else we've talked about so far. Let me introduce our 2 presenters. They're from the Social Security Administration here in Columbus. We have Mr. Gaishan Justice and Mr. Cy Cunningham. And they're going to just go ahead and take it away and tell you everything you need to know about Social Security. I will be putting some handouts on that back row of tables towards the end. We have some carry packages for you to pick up, some bags, and you can walk down through the 2 different sides and pick up some different handouts. After they do their presentation, I think you'll have a very good idea of what's going to be important for you to know, okay? So we'll put those out and you can pick those up on the way out. So without further ado, thank you very much, gentlemen. Take it away.
Thank you.
Grant will come out and reprimand me. Please, when we get to the questions, please wait for the microphone. And the reason I asked you to wait for the microphone is not because we don't all have camp voices, because I certainly have one, but we are recording this and we want everyone that views it later to hear all the questions. So if you'll wait until the microphone comes to you, we'll hand it to you, you can ask your questions. Okay, we'll have folks in the back that'll run those up and down the aisles for you. So please, please, please wait until you have the mic, okay? Now you can have it.
All right, thank you. Good afternoon. My name is Gaishan Justice, Cy Cunningham, formerly known as Ebony and Ivory. We're the tag team duo. We are here to have a little bit of fun with you. We're going to be very informative. We're going to be here well after the presentation is over to answer any questions, concerns you may have for your very specific situations. So keep that in mind. We're going to ask you to hold your questions kind of towards the end, and we'll have a big Q&A for everyone. Most likely, any question that you do have will be a question that your neighbor has. So just keep that in mind. We're here to kind of present to you a little bit about Social Security, what we do, in particular retirement, survivors. We'll talk about Medicare. We'll talk about government pension offset, windfall elimination. So I know there's some of you out there that probably experience a little bit of all of that. Now, To kind of give you a little background, Social Security has been around since 1935. We came about because of the Great Depression. This was to be a safety net to help individuals in their retirement years. It's turned into more than that, obviously. So we pay 70 million checks per month in this country. So every one of you, I'm 100% sure, has someone in your family that's being affected by my agency. And I say my agency because I take great pride to work at Social Security. I've had multiple family members work at Social Security. I've been there 15 years as of a few days ago. So it is what I live and breathe. I love it. There is no dumb question except for the one you do not ask me, because you might be missing out on something as we speak. So please take advantage of Cy and my time at the end. We're going to be here as long as you need us. So keep that in mind. And with that, I'm going to turn it over to Cy to talk to you about good old retirement.
I want to say good morning. Good morning. All right. I tell you what, I'm glad that you guys responded. I walk out in the lobby of the Social Security office every day and I say good morning and people just sit there. So I'm glad that you guys said good morning. With that being said, I'm going to give you some information. I'm going to follow the PowerPoint for the most part, but I'm not going to read the PowerPoint. You guys can read it. I want to give you some real life scenarios and things like that to try to alleviate some of the questions that you may have. It's going to be kind of dry, so, I may work on my stand-up, or I'll have Mr. Justice work on his. With that being said, I'm just going to give you a brief overview of retirement. Then he'll talk a little bit about spousal benefits, survivor benefits. We'll do Medicare, and then we'll go into filing online. We'll try to cover as much as we can, but if we do not, make sure you jot your question down or whatever, because I would hate for you to forget whatever your question is. Okay? All right. So really quickly, we're just going to go over what benefits are, how they work with Social Security, also how to file for certain benefits, once again, the Medicare, and then the MySSA account. And I'm just going to really quickly, because some people will say, well, what's MySSA? That's our online service portal. Basically, you set up a username and password, and you can go in and you can check out certain things about yourself. You can get reports as far as your earnings statement, how much you paid into Social Security, things that they used to send out in the mail, but since they're electronic now, you can get them offline. If you're already on benefits, you can do things like get a Medicare card. You can file for benefits. You can also look to see the status of things. And if you're already receiving, you can check out your payment history. All right? Make changes to your address, telephone number, things all right online. So you don't necessarily have to come into the Social Security office. But granted, I do want to see you in the Social Security office. So if you can do it at home, that's fine, but don't hesitate to come in if you need us.
I have a question.
Yes.
Why should someone sign up for a My Social Security account? What security reasons why?
I'll tell you this. The reason why you should sign up for a MySSA account is protection. Right now, we have several people filing online in other people's names, things of that nature, so it helps prevent fraud. So if you establish a MySSA account in your name, nobody else can. Okay?
Number one protection is to set up an account yourself.
You got another question?
I'm good. Thank you, sir. I already broke my own rule.
I don't think that pertains to us. All right. So the first thing that I want to talk about is being insured for retirement. I'm taking it that most of you are. Let me show of hands, how many are retirement age in the audience? Okay, all right. What are you waiting on? No.
Got those good government jobs. I see how it is.
With that being said, to get a retirement benefit, you have to be insured. And insured status means you have to have earned 40 quarters of work. And 40 quarters basically means right now it's 1320. So in a year's time, you have earned $5,280 for a 10-year period. Basically, that's all it is. To get a benefit, really, you have to have 10 years of substantial work with Social Security. Okay. Battery's dead. All right. With that being said, how we come up with your Social Security benefit, basically they look at the highest 35 years of your earnings. That's it in a nutshell. They index it for time. So let's say if you, back in, I don't know, the 70s, you made $1,400. Well, that's not $1,400 in today's dollars. So they index that money to get it to today's dollars. So you do get some benefit, even though you may have earned a small bit in the earlier years. So with that being said, once again, the highest 35 years, we don't look at the highest 3, anything like that. It's 35 years in total, and they come up with an indexed average to come up with your benefit, okay? All right. So basically what I want to let you guys know is you're paying into Social Security. It was not meant to be the end-all be-all for retirement. It is more or less a social insurance program, meaning it's communal, okay? So therefore, the money you're paying gives you a benefit, but also it helps out other people. But with that being said, what they do, once again, over the course of your life, they're looking at how much you've paid into Social Security and getting that 35 years. But we may have some people that may not have worked as much as you have, or may not have earned or paid into Social Security as much as you have. So with that being said, it tends to be a situation where lower wage earners still get a benefit. They may not get a benefit like you get, but they get, let's say, a higher dollar percentage based upon their monies versus what you would get on your monies. So this kind of explains that. So let's just take this example. If a person's making $18,752 and that's what they're paying into Social Security, that's their average income, they'll come out, and this is an estimate, they'll probably come out with a benefit of roughly $961. So based upon what they've paid into Social Security, they're getting a higher percentage of their funds back. In addition to that, if you see a middle income person, about $41,000, as you can see, the benefit roughly $1,584, they're getting about 45% of their benefit, of what they paid in. And then if you look at the max person, so this number here is no longer any good. I think that's from a few years ago. Right now, I think it's 128,000 is the cap for Social Security. So really, you do not pay, Social Security dollars on all your money. It's capped. So, how you're paying into Medicare and other retirements and so forth, once you reach $128,000, Social Security stops deducting from you, okay? So with that being said, the max benefit that I've seen, and I've been working at Social Security roughly 9 years. Kind of like Mr. Justice, I do enjoy my job. I enjoy helping people out. I enjoy, really when that person looks at me and they said, I'm getting that. That makes my day. But in the converse, when they say, I'm getting that, then I don't feel so good. So with that being said, paying into Social Security on the full and maximum, you're gonna look at maybe a $2,700 payment if you maxed it out. That's the highest that I've seen. And basically my job at Social Security right now, I help with online filing. So we have what we call our self-help service center. So you can come into the office, you don't necessarily need to have an appointment, but if you're willing to use the computers, what I will do is talk to you about your benefit, basically give you all the options I possibly can, and then we'll get you to file online. We'll review the application together, so on and so forth. But in the meanwhile, I want you to know that you can always come in. Our calendars for most Social Security offices are about 2 months out. But if you're willing to do the work yourself as far as entering the data into the computer, you can come into any office and use what we call our self-help centers. And that will get you in and out a lot faster. And there still would be someone there to talk to answer questions and things of that nature. All right. So I want to kind of give you an average or how this whole thing works. So basically, you can file as early as, okay? All right. But you have to be 62 for a full month. So if your birthday is July I don't know, what's today, July 10th? So if your birthday is July 10th, you would not be able to take benefits until August. That would be your first month of entitlement, okay? So even though you may be turning 62 July 10th, your first month of entitlement would be August. So with that being said, this is just a small chart to kind of show you, and we'll look at the full retirement age first. So full retirement age for most of you will be age 66. It's moving up for those people who were born in 56. It is now moved up to 66 and 4 months. Okay, and the younger you are, the longer you'll have to wait. All right, so with that being said, we start out at age 66. And the reason why 66 is important because that's what they have listed as your primary insurance amount, or your PIA. With that being said, this PIA is $1,000. We're trying to make it easy. So with that, if you're looking at filing at 66, you get your full benefit. Okay, you'll get your $1,000, you'll be happy, you can go on vacations, things of that nature. But for some of you that want to file early, take your money and run, 62 would, once again, 62, a full month of 62, you can file for benefits. As you can see, you're probably getting $250 less, okay? Now you have to look at it, well, why would I take $250 less? Well, you may need the money. Or you may be economically sound, and this just may be something that you can do to establish some more vacations or something like that. So it really depends on your economic situation as to when the right time is going to be. All right? So with that being said, as you can see, 63, it bumps up a little bit to $800, 64, and this is just the years. So the next slide will actually be a breakdown of what I would give you when you come and see me at the Social Security office. It's really going to try to give you at each point because your benefit changes each month that you don't take benefits, okay? So with that being said, we also have what we call delayed retirement credit. So if we go past 66, your full retirement age, your money continues to grow. So you get about 8% per year on your funds if you don't take them at full retirement age. Situation is, that only goes until age 70. Delayed retirement credit stops at age 70. So if there is anyone here that is age 70 and you have not taken your Social Security monies, go to the Social Security office today. Because there's no reason why you shouldn't do that because there's no benefit in waiting till after age.
I got space in my trunk. You can ride with us.
All right. Can you guys see this? Hold on. It was bigger when I stood right back there. I promise you it was. But this is what we call our benefit matrix. And actually, there are some in the back. So when you grab your packet, you can kind of look at it. But I'll just try to give you the high points. So as I talked about your primary insurance amount, your PIA, if you look at the green column, that's that $1,000 that's at the top of the green column, okay? That's your primary insurance amount. That's kind of where everything hinges. With that being said, if you're looking to take benefits earlier than full retirement age, it's going to be reduced for the amount of months that you take it early, all right? So I guess you can see it. It's right by reduced. But there's an RF in that first column with the numbers that start with 1, 2, 3, 4, so on and so forth, and it goes down to 47. All right? So that basically means 47 here would be you taking benefits at the earliest possible month, and you're being reduced by 47 months. So as we showed you on the previous slide where it was $750, well, that calculated it as if you were taking it in July. Once again, August would be the first month that you could take benefits. So you would be looking at a payment of $754 per month, okay? And as you can see, each month, your benefit continues to grow. And it grows and it grows and it grows. Now you can take it at any point in time. I want to say this, Social Security can take an application as far as 4 months out. So Don't come in at the beginning of January if you want to file for December, because we can't help you at that point in time. But we can take an application as far as 4 months out. And if you do schedule an appointment, the day you call to schedule that appointment, you're protected from that day. So if you don't get in till 2 or 3 months later, they will take you back to that original date that you contacted us to schedule the appointment. So you wouldn't lose anything except, you know, a little bit of time in filing. That's why I said come on and talk to us at the Self-Help Center. With that being said, as you can see, you continuously move up until full retirement age, where July would be your full retirement. You would receive the full $1,000. So I'm going to go over here to the yellow section. And this kind of shows, once again, those delayed retirement credits. So as you see, once again, each month, your benefit continues to grow. If you don't take it, it grows. So with that being said, I can't really see the number, but we'll jump down here to January of 2019. You're looking at a payment, and the dates are over to the right side. But you're looking at $1,040 if you waited till January of 19 versus taking benefits in July of 18. Okay, so with that being said, it all depends on what you need. If you know, hey, I'm going to need $1,040 going forward to make my budget work, then you might want to wait that time. If you think, hey, I can take my retirement and deal with the $1,000, and you might want to do that. There's no wrong answer in when you take benefits, okay? So with that being said, I want to talk to you a little bit about how work kind of plays into this as well. But I'll kind of give you some just general information. We talked about basically the age range of where things are. So just to kind of give you guys a picture of what the age ranges are. So basically 43 to 54, 66 is full retirement age, okay? 55, 66 in 2 months, 56, 66 in 4 months, 57, 66, 6 months, so on and so forth. So once again, anybody that's born in the time of 1960 on, basically you're going to be 67 plus. We'll talk about solvency a little bit later, but that's part of the reason. That's why the age continues to grow, to make sure that there is money, you know, once things, excuse me, as things move on. All right. So basically, I just want to let you guys know, on the internet, there is an estimator. So if you guys don't know what your benefit is, you want to know what it is today, you can go on Social Security's website to the estimator, and it'll have you key in some information. Now, one, if you've already filed, or if you're receiving a special pension, we'll talk about WEP a little bit more as well. But basically, if you're not receiving any benefit currently, you can use the estimator. If you're using the system here, I do believe there is a windfall elimination.
There is, yep.
As well. So you might even be able to calculate what, if you know what your pension's going to be, if you're civil service, things of that nature. And when we get into the windfall, I'll talk about civil service a little bit. We'll talk about Ohio PERS. I know some of you are across the board on different pensions that you may have. Ohio is one of 7, 8 states that have the windfall elimination. Don't try to move. But with that being said, you are offset. Your Social Security benefit would be offset depending on how long you've paid into Social Security substantially and what your pension's going to be. All right. So, like I said, I wanted to talk to you about work a little bit. And I'm going to try to give you these scenarios real quick and fast. So, those of you that are 62 through age 65, there is a threshold. Now, yes, you can work and still receive Social Security benefits. However, the amount that you can make without it affecting your benefit, they make a decision for you. So currently, the amount that you can make and still receive Social Security, once again, from 62 through age 65, is $17,040. Okay? So with that being said, if you go over that threshold, then how it works for an offset is there's $1 for every $2 offset of the excess. Does that make sense? Okay. So basically, I'm going to have an example for you in the next couple slides here, just to kind of show you how that would work. But the year you're going to turn full retirement age, like I say, for most of you, it would probably be age 66. There is a $45,360 limit. And how it works is, it's only from January, and let's just say your birthday is once again in July, that's only from January to June. Because once again, once you turn 66, you can make as much as you want and there's no bearing on your benefit. Okay, so you can continue to work here. You can find a job making $1 million and it will not affect your benefit. I'll tell you this, if you find a job making $1 million, you
Call
need
us.
to call me. Yes.
I have my card ready for you.
Right. So with that being said, that's kind of how that is affected. So that's why it says full retirement age or above, no limit. So continue to work, so on and so forth, and still get your Social Security benefit.
I'm going to chime in real quick. That is so important, because if you are, pretty much what I want to tell you is, if you're in your year of full retirement, when you're going to attain your full retirement, let's say you have that July birth date, you want to see us in January. Because we want to sit down and see, if you're making $90,000 in this scenario, you can get your Social Security benefits effective with January of that year. You might take that small reduction, but think about what you can do with all that money. Invest in the stock market, save for your vacation, do what you want with it, right? So there's that little window of opportunity that a lot of people just pass up on. They've decided in their head, I'm doing 70 or I'm going to wait till full retirement, and you potentially gave up 6, 7, 8 checks for the year that you could have been receiving January of that year forward. So please, do your due diligence, come into the office, sit down, get an estimate. You might be surprised and say, wow. Or you might even say, oh, I can go a little part-time now. I could reduce. I like my job, but I don't want to do it as much. So we might be able to help you get there.
And just to kind of piggyback, dovetail, it makes sense to just check with us periodically to see what your options are. Because there are options that some of you may or may not know about. Hopefully we'll cover a good percentage of them today, but you may have friends and family members that may not be taking full advantage of Social Security. Some people may say, yes, I want to wait till age 70 for an additional $320. But ultimately, if you're receiving checks over that period of time, the break even might not make sense. I mean, nobody knows when they're going to pass away or anything like that, but it may make more sense if your break even is 20 years from now. So I'm more or less saying that it may be a bad decision in 20 years from you being 66 that you took your money at full retirement age versus waiting till age 70. Okay.
I'll give you some general numbers. If you 62 versus full retirement, it takes you about 12.5 to 14 years to make up the difference. So like our $1,000 versus $750 scenario, think about that. You would get that $250 less, but you get $750 for 47 months before you reach full retirement. So then if you divide that by the $250 in increase that you would get at full retirement, it would take you on average 12.5 to 14 years to make up the difference. So essentially, if you're not working at 62 and you can potentially file with us, it might behoove you to do such, because unless you can guarantee me you're going to live to be 78 to 80, you might make a bad call if you take that full retirement amount. And it's a morbid topic, but this is why we're here. You have to start having these conversations. I don't care if you're 35 or 65. You should be talking about this with your husband, your wife, your children, etc. So that's why we want to maybe push upon you a difficult conversation about death, etc. It's a very important topic.
All right. So with this slide, basically, we talked about the threshold for how much you can earn, and that's just work. So your pensions are not included, child support, gains, interest, dividends, pensions, so on and so forth, like I say, unless it's a special pension where it was a state pension or government pension where you did not pay into Social Security. Okay, but if you have a 401k out there, that does not affect your Social Security benefit. Okay, so once again, just the earnings from work and self-employment. Consider that work as well. All right, everybody okay right now? All right, so we're going to get into some fun stuff. I got some examples here. So just to kind of give you a feel for how this whole thing works with the earnings limitation, I'm going to have you throw up a show of hands again. How many are in between that 62, 65 range? All right, young group here. With that being said, that's 17,000. So we'll look at you making $27,040. It's going to kind of make it easy numbers. So basically, you've gone $10,000 over the amount that you're allowed to make. Okay. So what Social Security would do at that point in time is take that $10,000 because we've already subtracted out the threshold. So you have $10,000 left. So that excess is divided by 2. So the offset in itself is $5,000. And in a nutshell, what Social Security is going to do is basically withhold $5,000 from you based upon how much you've earned. So with that being said, let's just say your payment was $1,000. So really, and I know here it says the example was $800, but we'll get into that in a second. But they would just withhold 5 checks from you for that $5,000 offset. But the plus side of it is, and you guys remember the chart that I showed you. So if you are in suspense based upon work, what would happen is, let's just say if you took benefits at age 66, well, you can't do that. That's a bad example. Let's say if you took them at age 62. You took them at age 62, basically you took a reduced benefit. The months that you're in suspense, Social Security is going to give you credit for those months. So it would be like you filed in September, October, November, December timeframe. So they'll pay you that amount that you're due for December versus making you stick with the lower amount that you started with, okay? So basically what it's telling you here in this example is that you're still going to receive $4,600. So you can file and be in suspense. I mean, it's your choice. It's just you may be subject to having some checks withheld. But in addition to that, you may be receiving some money for the year, okay? But I want to let you know, like, if you come in, let's just say in August, and you say, hey, I want to file for benefits this year, and you've made this $27,000, it really doesn't make sense for you to file in the current year for the simple fact you'll be in suspense for the rest of the year. Now, if you come in and see us in January and you're in suspense for 5 months, then you still have 7 months that you'll receive payment during the year, if that makes sense. Okay? So, any questions on that?
Keep in mind, in that scenario that he's giving you, the individual is eligible for payment in January. So that would be like they turned 62 the previous July and they've stumbled into the office in January of that year. And they talk to us then, we might have enough months to withhold from you and then you get seven checks for the year. So it really depends on if you're eligible. Now, if your birth date's in July and you come in August, well, there's not many months we can play with there because we've already used half the year. So it's kind of confusing in that sense, but just keep in mind, like, it's really important that you're checking and being financially literate through our website so that you can have a better understanding of what you want to do. We want to hear what your roadmap is, and then we'll tell you if you can go left or right. That's kind of what we're there for. We're here to help you get your money. We're not paid to, like, oh, we'll talk you out of stuff. I talk you into stuff before I talk you out of it. I could show you an equation that makes you think. That's why I threw out the 12 years to 14 years to make up the difference, because I see a lot of people that pass up on money that they could have done a lot with. Right.
So moving on to the next example, let's just say you earn that $63,000. The threshold was you're earning 63, threshold is 45,360. So basically, you've gone over the threshold amount by, what, 2120. So with that being said, there still may be a month that you're in suspense, or 2 months. But once again, once you hit full retirement age, you can make as much as you want. So they're only going to suspend you for that smaller portion. So as we stated before, you still would receive benefits during the year. Now, a lot of times what happens, and when I talk to people, it becomes a situation where, you know, they're not going to make $45,000 between January and June. So once again, you do have that option of potentially filing earlier in the year and receiving benefits for that whole entire time frame. But with that being said, going back to this example, if you could see you were going to receive basically the $5,600, so they're going to subtract the offset. And the difference between full retirement or being that full retirement year versus being 62 through age 65, not only does the amount of the threshold change, but the percentage that they'll withhold in the excess changes. So once again, between age 62 and age 65, it's 1/2 of the excess. It's 1/3 of the excess if you're getting ready to turn 66 in that year or full retirement age. So that's why you see the difference that they're only going to withhold $706 even though you went over the 2120. Okay? So as I've stated before, really what you guys need to do, you can always come into the office, you can call the offices, you can get on the estimators, you can really try to see what your benefit's going to be. But like I say, at the end of the day, yes, we're trying to help you as best we can to get the best benefit that you possibly can. So we'll give you every option, every scenario, tell you when's the best time. Now, we can't say, yes, you should file in March, but we can give you the information to let you know if March is a good decision. Isn't it time for one of your questions?
Questions?
Yes. You don't have a question for me?
I don't think so. I was napping.
I see a couple of those napping. I thought I was excited.
Mm-hmm. All right, my turn. Ebony stole all my flow. So I'm going to talk to you a little bit about some depressing subjects again, because that's how I drew the short straw. And we're going to talk about spousal benefits, and we're going to talk about widowers' benefits. So Social Security pays to dependents. So we can pay, if you have a child that's under the age of 18, or if you have a grandchild that you've adopted, that's pretty common nowadays, they potentially are eligible in your record, just like a spouse. So keep that in mind. So you could potentially retire from us. You get your check unaffected as a number, we call them a number holder. You as the primary person, you're a number holder. You get a check. If you have a dependent in your household, a spouse or a child, they can receive benefits that doesn't affect your benefit at all. So sometimes there's 2, 3, 4 checks coming out to one single household depending on their scenario. So we look at spouses pretty simple, and we're going to show you a scenario here. It's simple until you bring in these bottom categories: OPERS, STRS, civil service. For a lot of you, that might be the case. Those can potentially cause a little bit of an issue, and we would calculate a little differently. So spousal benefits. The benefit is 50% of the worker's unreduced benefit. So the way we look at it, we're going to go over an actual scenario. I'm going to skip over some of this because we're limited on time. The spouse, essentially, if their benefit that they can receive at full retirement is more than half of the husband's or the wife's, whoever the highest earner is, they potentially would not be eligible if theirs is more than half. So we're going to go over an actual scenario because I know that's a lot to think about. This is talking about the reductions. It's the same with retirement. If you take it early, you receive a reduction. Pretty simple, right? So this gives you if you're a divorced spouse, because a lot of people miss out on this benefit. So if you're a divorced spouse and you were married to someone for 10 or more years, and that's down to the day, because I've seen people literally get divorced on the 10th anniversary, just so the spouse could get it and they wouldn't have to pay alimony. Good on you if you can convince her to do that or him that, but that's the scenario. So you have to be unmarried, you have to be 62 or older, same requirements as retirement. Your ex-spouse has to be currently eligible for benefits, because we have dependently divorced spouses that could be eligible for benefits. And the benefit that you're entitled to still has to be less than half. So that's always the rule with a dependent for spouses. So if we're going to go over this scenario here so you can see it. So Fred and Alice both paid FICA taxes their life. Fred is eligible for $1,600 at his full retirement age. Alice also worked outside the home. She didn't work and earn as much, but she did earn a benefit of $1,000 at full retirement. So if I take the $1,600 and divide it by 2 to give you my $800, Alice's benefit on her own is more than what she can receive off of Fred's benefit. So therefore, she's not going to get anything off of Fred's record as a living spouse. living. 50% rule is only for living. Upon death, if Fred dies before Alice, then Alice, we change the computation. We look at 100% of what Fred was getting. And so at that point, Alice needs to visit us. Not only for the lump sum death payment, which is still only $255, which was a lot of money in '35. It's not a lot of money in 2018. So we've never changed that. That's a legislative change that would have to happen with Congress, et cetera. So we've stuck with $255. So she would see us for that, but a lot of people don't realize, they think, oh, I'm already getting benefits from you guys, I'm good to go, when in fact, she's actually eligible for benefits as a widow because we changed the way we compute. So widowers, widow and widowers, reduce benefits as early as 60. So this is a little different than retirement. If you are a widow or widower, you can inquire with us at 60 years of age, and you may be eligible for benefits on your deceased husband or wife's record. Again, annual earnings test is what we call it. So if you are working, all those same computations apply. So if you aren't working and you're 60, if you're in the room and you're 60 and you have lost a spouse, and you don't have to have 10 years of marriage for this. You can actually have 5 years of marriage. As long as the marriage ended in passing, then we can potentially pay you as a widow or widower. So children, if you pass away at any age and you have the quarters of coverage to be eligible, your dependent children may be eligible for benefits on your record. As long as, and a dependent for us is anyone that's under the age of 18, 18 to 19 in post-secondary school, or they are disabled, which we deem as a disabled adult child. So a disabled adult child is potentially eligible on a parent's record until their passing. So we have some disabled adult children that are on benefits until their 80s, 90s, until they pass away, off of the parent's record. So that's when you get into that whole solemnity argument. Some people think that's not fair, but if you have a severely mentally disabled child who's not going to be able to ever take care of themselves, that's what we're here for. We're here to help you. We keep 10 million children out of poverty every month. Social Security does. So, and that's partly you. You should pat yourself on the back because you pay into that system, and it really does help families. I've seen hundreds of families that have been helped by this. Surviving spouse, again, we're giving you the reductions. Just know that there are reductions. If you take at age 60, that's the most common time a widow or widower will take, you get 71.5%. The longer you wait, the more you get. Let's say you're married and you're in your 70s, 80s, and your husband or wife passes away, we look at the computation at that time, and you're going to receive one of two things. Either 100% of whatever the deceased number holder was receiving, or 82.5%, whichever's higher. We give you the most money we can. So just know that if anyone passes, your husband, your spouse passes, just come in and make sure you check with us, because you may be eligible for benefits depending on your circumstance. One thing I will mention there, so for deciding purposes, when you're thinking about retirement, here's a big one, okay? This is one of the few that I would actually say is a good argument for why you should wait. With a widow's benefit, the surviving spouse is actually eligible for 100% of any delayed retirement credits you took as the number holder. So if you waited to 70 and you're the man in the relationship and you pass away, your wife is actually eligible for whatever you earned all the way up to the 70 years of age amount. So they get full credit for that. So that is a huge benefit for those that maybe have limited income and they know that Social Security is going to make up the vast majority of their income in retirement years. Sadly enough, in America, 70% of people rely solely on Social Security. So it's not getting any better either, to be honest with you. So keep that in mind. And so that's a way you could benefit. If you know you have poor health, et cetera, and you want to advantage your survivor, that's the way to do it through Social Security. The other good news is, let's say this is one of the few benefits that we can actually not deem you as filing other benefits. So you might be eligible for retirement. We're not going to force you to take retirement, even if your retirement's a little bit more than what your husband or wife who passed away's benefit is. We let you decide, okay, I'm going to take my widower's benefit and let my own grow and get those delayed retirement credits. So you can pick and choose at that moment. And we'll sit down with you and kind of talk you through the pros and cons of that. But just know that you can pick and choose with that one. If you're under full retirement and you're here to file and you're both living, you're deemed as filing for any and all benefits that you're eligible for. So we don't let you pick and choose then. But if you are a widow or widower, we will allow you to pick. All right, filing for benefits, internet, telephone, office. They're all great options. If you've ever been here to the Hamilton Road office, I apologize. It is, yeah, it's busy. We're the busiest office in the state of Ohio. We see 55,000 people a year. I only have 28 staff. That's counting me. And I'm like half. So, you know, you're gonna wait. I promise you, you'll have good service once you get through your wait, but it is a long wait. So internet, internet, internet. I'll tell you now, it's faster, it's quicker, it's actually safer. If you happen to know someone that's filing for disability, then you will have to, with disability, you can do it online also. And we see that more people are approved for disability when they file on their own, because you can put it in your own words, et cetera. So.
Except for the fact that DLA is special, and these gentlemen have committed to coming back at least one time so that we can make appointments and people can sit down and have a face-to-face with them. So we won't have to make the trek over to Hamilton. Okay, so round of applause for Social Security, right? Woohoo!
So, okay, we're pretty much almost out of time, and we want to definitely question and answers. Quickly on Medicare. Quickly on Medicare. So we'll tag team this one real quick. 65 and older, if you're 65 and older and you're still working, don't come see me. I don't want to see you, right? Because here's the reason why. You're due for you're eligible for a special enrollment period. And that's an 8-month period where you can be working, and let's say you retire and you're 67. You could have delayed getting your Medicare, which means you're not paying me $134 a month for Medicare that you don't need. Because if you're currently working at your current employer, or your spouse is working at their current employer and have you covered, you don't need Medicare. Medicare is not going to be primary. You're going to be paying $134 for nothing. They were going to bill your primary and keep it moving. Now, if you have something drastic occur to you, catastrophic event, heart attack, you're flown in life flight, med flight, et cetera, God forbid. But if that happens to you, guess what? We will backdate your Part A of Medicare, which is what covers you for hospitalization, inpatient stays, et cetera. Part B of Medicare only covers you for supplemental medical insurance. That's for doctor's visits, outpatient visits, et cetera. So a lot of times people come in thinking they have to file 65. No, if you're working, I don't need to see you. You go ahead and go keep working, because it's just a waste of money for you. But we're willing to talk to you about it, and there's great resources on the website. But in general, there are some exceptions on the waiting period, et cetera.
Now, if I may jump in, you talked about Part A. So there's Part A, Part B, correct? Hospital visits, doctor visits. If you do want Part A, there's no harm, no fouls. If you don't take it, like you said, if you're working and so forth, you don't take it, there's no penalty associated with it. As long as you're entitled to a Social Security benefit, then you don't have to worry about Part A. They're going to give it to you for free whenever you file. Okay?
Go ahead. Nope, Part A is free of charge. You paid for it. You know, you paid into, 2.45% that comes out of your check each month pays for Medicare. So your employer kicks in the additional 2.45 also. So it's paid for by you, and Part A is free of charge. So there's no penalty. There's no reason not to, other than it's really not going to be billed for anything unless you have something catastrophic happen to you. So if you want peace of mind, come in and file. File online. You can do these online. So
10 minutes.
Yeah, it's literally 10 minutes. If you know how to, you know your address, your name, your social, you're done. So we're giving it away. So there, Part C, we don't talk about Part C.
Hold on.
Yep.
Just for the recording purposes, as far as questions go, they're going to be coming down the aisles with the microphones. So if you just throw up your hand, and we'll try to do this kind of in tandem, hybrid, to get everything done and get the information and also get your questions answered.
So Part C is a supplemental program that you'll have to choose if you want. You have HMO versions of it. For example, here in Columbus, the biggest HMO Part C plan, you only can go to Mount Carmel East. It's an HMO. So you got to go where they want you to go. There's other plans where it can be PPO. You can go pretty much anyone that's in network. But Part C, we don't help you with, because I might say, hey, go talk to my dad at Aetna. You know, I'm not in that business. So we don't give you any advice on Part Cs. That's for you to educate. If you're in the 60, almost 5 range, I'm sure you've been inundated with a million mailers in your mailbox. Probably what you get every day. It's your call. You have to self-educate. The good news is Medicare.gov has a formulary finder where you can plug in all your information, and it will spit out what the best plan is for you. So use it. That's there for you to use. Part D, we do handle, that's the prescription drug plan. Extra help for prescription drugs is specifically for those that are low income. So you kind of will know if you're already talking Medicaid and you need to supplement that, and that's going to be in your retirement years, you're probably going to be forced to take a Part D plan where we help you pay for your prescription drugs. Anything to add, sir?
No.
All right, zipping through. So there's what it covers. Inpatient, no fees for you. There's some things that are covered too. Pap smears, colonoscopies, preventative care issues are covered in full. No copay, no nothing for Medicare. So that is an advantage for that also. The premium for Part B, as you probably already have figured out, goes up each year. It actually has gone down. Be careful who you vote for. So it does change. Go back and look historically. So this is what I kind of explained, HMO versus the drug plan, et cetera. I'm zipping through.
Just real quick, Medigap. So there's supplemental plans or advantage plans, and then there's Medigap. I just want you guys to be sure on what Medigap is. Basically, that's a supplement for Part A and Part B. So if you get a Part C plan, which is an advantage coverage or gap plan, then basically you don't need Medigap, because Medigap is really only covering the A and B. It's not giving you anything in addition. It's just lowering your copays, co-insurances, things of that nature. But the advantage plan gives you additional coverage. Okay?
So for Part B of Medicare, you, like I said, if you're working or your spouse is working and they have you covered under your current, such an important word, your current employer. You can't be retired and getting, Blue Cross Blue Shield from your retirement years at civil service. You have to be getting it from current work, current employment. And if you're not, then you suffer potentially penalties for Part B for signing up late. So if you are, though, covered under current work or your spouse is and they have you covered, you can delay it, and then you get a special enrollment. So you have 8 months to kind of get into us and tell us, hey, I want Medicare Part B to start X date. So as long as you get in within that 8 months, there is no penalty. You get whatever the new premium is for that year. No extra cost to you. So just keep that in mind. Save yourself some money, but also don't make the mistake of not coming and see us when either you or your spouse stops working and you have no longer current coverage from current work.
I would say come in the month before work is going to stop.
Right. We give you some forms. There's a 40B form. There's a CMS form that we get, a L564 that we give you to take back to your employer to show that you had credible coverage up through that point. And that's what gives us the authorization to say you do not suffer a penalty for signing up. So there are some little things you have to do, but that's why Mr. Cunningham's kind of telling you, come in the month before, we'll get you the forms. Super easy, super simple. Your HR department usually can get it done in 5 minutes. All right, this just kind of shows you the enrollment. We won't go over that, but that's just kind of showing you, if you choose what month for Medicare, how soon can we get you enrolled? And luckily with the special enrollment, as long as you sign, like if you sign up in the NEP +4, we can get you C coverage the very next month. So that's why he's saying come in 1 month before you think you're going to stop working. That way we can get you signed up.
And there's no gaps or anything before you're covered.
Yeah, you're covered. It's just like the one thing I wanted to kind of piggyback on the retirement benefits. If you're a July birth date and we can only pay you with August, your check actually doesn't come to you till September.
Definitely.
We pay a month behind. And the reason being is if you'll appreciate this, if unfortunately you're married and one of you passes away, we're able to then go in and get that money back before it's paid to you and causes an overpayment. So that's why we pay a month behind. Medicare gets their money a month before. So they're getting paid before they cover you. So keep that in mind when you're planning for your retirement. And the good news about Medicare is it comes right out of your Social Security check. If you're already an annuitant, you're getting something from us, Medicare is going to just come right out and take it. You don't have to do anything. There's no paperwork or anything like that. So if you're not receiving benefits from us, then they do billings. And the billings can be pretty harsh for some people. You have to do quarterly billing. So your bill can be $400, $500 depending on how many months are involved. Usually it's 3 months, but when you're first signing up, sometimes it's 5 months. So it can get a little more expensive.
Now, I will say this. If you do set up what they call Easy Pay through Medicare, like when they bill you, you can put it on a credit card or have them draft it from your bank, so that way you don't have to be billed quarterly. You can be billed monthly.
Health insurance, we're seeing this HSA accounts where you're paying in, like, you get a $5,000 allotment. Some employers are going to this model. You can't get Medicare and have that. You can no longer contribute to an HSA based on law when you start receiving Medicare A and B. So Don't make that mistake thinking, now you can withdraw the money that's in your SHA account, but you can't continue to contribute to it, which there's some tax advantages to that. So we don't get into the nitty-gritty of that because that's out of our realm. It's not really a Social Security thing. This is about your retirees, your plans. You can't be required to take it. Just be careful. We hear a lot of TRICARE people come in.
Definitely.
You need Medicare. Don't fool yourself. We see so many people that make the mistake. They have TRICARE thinking, oh, I don't need Social Security Medicare Part B. And then 2 years later, they come strolling in and we hit them with the 20% penalty because actually they did need it. Right on our website, there's a great handout and information about TRICARE, and it literally says you in the first sentence, you must take Medicare. So I'm telling you now, if you're Medicare, or if you're TRICARE and you're military, take Medicare. You will regret it if you do not. This is talking about the general enrollment period. If you don't accidentally, say you forget, and you don't come in during that 8-month period, we sign you up for the special enrollment. You get stuck in the general enrollment, which we take those applications January through March, and then you don't get coverage until July 1st of that year. So you would have gaps. So that's why it's so important that you know to come in and talk to us when. So this is a big change for us. We no longer are putting the Social Security number on your Medicare card for your safety. And that's really a big thing. Question?
It's not a question so much as just to let you all know, I know some of you have to get back to your desks because you're on a short timeline. It is 12:30. The gentlemen have consented to continue on, and we will record until we're finished. So if this is the time that you all need to go back, please. On both sides of the exit are some handouts, and remember that everything's available on their webpage. I'm not trying to run your clients off, but I know several of them have been kind of getting concerned because they're on a time.
For those of you that are going back, thank you for coming.
Yep.
So, we'll see you for the next retirement seminar.
So the good news for all of you is you have OSHIP, which in Ohio, it's the Ohio Senior Health Insurance Information Program. Horrible name. Every time we say it on the phone, people mistake it for something else. And then they see their benefit amount and say, oh, I know what he was saying. So OSHIP can help you get through all those difficult Medicare questions, et cetera. So use them. That's their website. ohioinsurance.gov. They're great actual human beings who have already been through what you're going through, answer the phone. So they're able to help work that formulary finder from Medicare for you, et cetera. So great resource, free of charge.
It was perfect timing. We were just about there anyway, weren't we?
Yeah,
You guys
we
are so good.
We already gave you the internet spiel. So let's do some questions.
We got lots of questions. This
Excellent.
gentleman tagged me when he first walked in, said that he had a question, so.
I have 2 questions, please. Okay, the first one pertains to when you're talking about Medicare, when you need to sign up for it. If a person retires at age 60, just for example, when should they go into your office and then sign up for Medicare as their primary?
Okay.
Since if you're a government employee, you're going to have your government insurance as your supplemental.
So the good news is if you've already filed for Social Security benefits at 62 is the earliest you can do for retirement. So let's say you filed at 62, Medicare will automatically enroll you at 65. You actually get the card 3 months before your 65th birthday month. All you do is sign the card, put it in your personal wallet, you're done. I don't need to see you again.
Okay, so the Medicare starts at 65.
Correct.
65, not full retirement age, 66.
That has not changed, and hopefully it does not.
Also, we were discussing different periods. They talked about a special enrollment period, and we talked about a general enrollment period. There is an initial enrollment period, and basically that's 3 months before you turn 65, the month of, and 3 months after. That is your initial enrollment period. So if you're not working, not covered by a group health plan, you do need to see us at that point in time.
Okay, can I ask you one other question? Has to do with when you're talking, you said that our 401k, I'm assuming you're talking about TSP, that it does not affect your Social Security.
Correct.
What about FERS? I may have missed that.
Nope, doesn't affect you either. So that's the good news. FERS employees, you can collect your FERS benefit, and if you're lucky and they don't get rid of the supplemental, you can get that from 57 to 62, and then at 62, FERS expects you to file for your Social Security benefits. So then your FERS supplemental goes away, Social Security kicks in, and Social Security is not affected at all by your FERS amount.
Okay. And when you touched on supplemental, you said supplemental also does not affect Social Security?
It does not.
Thank you very much.
Yep. In fact, if you're disabled or you become disabled before you can reach retirement age, you can actually receive disability from FERS, and it will not affect your Social Security if you're eligible for Social Security disability. So a lot of people get a FERS retirement check, a Social Security disability check, and they start touching and convert their TSP to an annuity. So they have 3 checks coming in each month.
Does windfall elimination affect FERS?
No, FERS is because under a FERS employment, you're paying into FICA, you're excluded from any windfall elimination. Great question.
That is truly the rule. As long as you're paying into Social Security for the most part, then there wouldn't be a windfall elimination. But if you're paying into another government agency and not Social Security, that's where the offset happens. But once again, there may be a situation where there's an exclusion from the windfall if you've paid into Social Security substantially for 30 years, but we can calculate that and give you that information.
Your slide indicated or stated that when a person is entitled to Medicare, you're entitled to Medicare within that window around your 65th birthday.
Correct.
If you are still working and you are covered by medical insurance, does entitled mean received?
So when we use the word entitled, we often mean you have to meet the eligibility requirements. So Medicare, much like Social Security retirement, you have to have 40 quarters to be eligible for Medicare Part A for free. Part B, we see a lot of people that are civil service, for example, where you haven't paid any FICA or Medicare for your whole life. You're actually still eligible for Part B of Medicare, but you have to file for it.
So if a person is 65 and is entitled, they meet all the quarters and everything, but is still working and receiving medical benefits and does not want to take Medicare, that is acceptable procedure.
Yep, long as you're covered under your current employer's group health plan, you're golden.
One follow-up question, can the insurer force you to take Medicare?
No, not under the current laws.
Okay, thank you.
So just to piggyback, I just want to state for the record, he says current employment, and I want you guys to get that. So retirement coverage, COBRA, things of that nature does not constitute a group health plan. So it has to be coverage due to your current employment or spouse's current employment.
When you receive Social Security benefits, are there tax liabilities? Are there federal and state taxes paid on that?
All right, so
He's a certified accountant.
there is, but it's only at the federal level. So there's no state tax associated with it. There's no city tax associated with it, no local, anything like that. But what we do is, if you're receiving a Social Security benefit at the end of the year, you'll receive a 1099, just like a regular pension, and you would add that into your income at the end of the year.
Do most beneficiaries, for instance, my wife is already at that point where we're doing it online. We're just at that last step where we're going to put in the direct deposit information.
Okay?
Can she elect to have taxes taken out?
You can't do that online, but there is a form that you can fill
That's
out.
what they said. They're going to send us a form. Do you know what most people take out of their taxes? Is it a...
This is what I'm going to recommend. Do you have a tax accountant?
Yes.
Okay. Talk to them about what your income's going to be going forward for the next year, and then have them suggest what the percentage is, so that way you'll cover yourself and you won't take out too much and you won't take out too little.
Appreciate it. Thank you.
Yep. And we only can take out 7, 10, 15, or 25%.
22.
Oh, 22? They changed it? Oh,
Yeah, these, yeah. 7, 10, 12, 22.
okay. I don't think so.
I'll check that. But
Google it. I'm pretty sure I'm going to bet my 15 years against his 8 that it's 7, 10, 15, and 25.
it's 25.
On it. Somebody tell us the answer. All right, question.
Yeah, mine's a little more complicated, so I'm not sure you can answer me today.
And I'll tell you if I need to take it offline.
Okay. So I'm a widow. I've been a widow for 21 years. I've been collecting CSRS annuity against my husband's retirement. So that means he didn't pay Social Security when he was doing CSRS. However, he had enough credits and leftovers before he died in private sector work. Our children collected Social Security benefits till they turned 18. So my question is, I'm going to retire at 56. I'm under FERS. I don't know if there's a possibility of collecting anything of his Social Security once I get to that age.
Excellent question. And there's actually an easy answer.